And thanks everyone for being here today. So my name is Neil Pott. I'm a BMT physician here at Seattle Children's and Fred Hutch Cancer Center, and it's been a pleasure taking care of some of you in the hospital. And also, I'm glad to be here this morning to talk about a topic that I'm passionate about and share some information on educational issues that could occur after cancer therapy, and some practical tips on what can be done to prevent or mitigate them. So this is the outline of my presentation. So I'll be talking about just a broad overview of long-term complications that could occur after end of cancer therapy, and then specifically talk about the school and educational issues that could occur at the end of therapy. And then lastly, we'll talk about the ways to prevent or mitigate those issues. So as Dr. Chow mentioned, I don't have to tell this crowd why the childhood cancer survivorship is important, as we all know that there are almost 500,000 childhood cancer survivors living in the US right now, and almost all of the survivors face at least one complication, whether it is mild or severe, after end of therapy. And the complications are due to various treatment exposures, as Dr. Chow mentioned, but it also could be from general cancer experience. And these are just the broad categories of various long-term complications after completion of therapy, and this could affect a patient's physical function, psychological health, also social and financial health could be impacted, including their patient's ability to return to work or school, and also secondary cancers could develop after end of therapy. So now specifically focusing on the importance of school and education in general. We all know that at personal level, education is important for children's cognitive and emotional growth, also helps with social development, and then in the long run, that's the traditional way people get employed after completion of education and get their income. And at societal level, education helps with overall workforce participation and overall economic growth of the country. Specifically for patients who have undergone cancer therapy, school integration is considered a part of their recovery. It's sort of a milestone. It's basically considered a work for children, and it could provide a sense of normalcy after completion of therapy. Also, patients again feel being back in control. They would meet with their friends and have that social support, and also it can be a huge self-esteem boost. But there are many challenges that could come up when patients are returning to school, and also related to their academics. So here I'm showing you some of those challenges in different broad categories. So first of all, patients can have low attendance expected because of the clinic visits that they could still have after end of therapy with the doctors, and also unexpected because of some illnesses that could come up after end of therapy as well. Also, studies have shown that patients can have poor social and behavioral outcomes, such as interpersonal experiences with teachers, and also some concerns of being teased or bullied by some classmates because of their how they look or feel after they return to school. Also, patients can have adverse classroom behaviors such as aggression or withdrawal, and also school disengagement. There are also some adverse academic outcomes that could be seen after completion of therapy, such as need for repeating a grade or a failed grade, also need for a learning disabled or special education program, and also this could in long run affect the patient's educational attainment. And there are some studies that have looked at specifically factors that could be associated with this educational challenges, and they have found that the type of cancer and treatment can impact this significantly. Specifically, if a patient is treated at a very early young age with radiation, and that could impact their developing brain. Also, the challenges that patients may have before starting cancer therapy also could emerge or get worse after they return to school after completing cancer therapy. Also, type of school and the resources the schools have also matter when their patients are returning, what sort of support they could provide to cancer survivors. And then, in general, support from all the involved stakeholders is important for the successful return to school process. So next, I'm showing you some direct quotes from patients who have returned to school after completion of therapy, and some challenges that they have faced. And I have divided them into 3 different categories: the physical challenges, social and emotional challenges, and academic challenges. The main idea of showing this quotes is just to make sure that patients feel that they are not alone. This can happen to anybody after completion of therapy, and just to highlight the issues so that it increases awareness. So the one patient had mentioned that they had to change their school because their legs were so sore after completion of therapy, and there were lots of stairs in the building. So they had to find a school that had more support for them, elevator access. Also, patients can have challenges with concentrating. So a patient reported that they had a difficult time concentrating because they just felt crummy all the time. In terms of emotional challenges, this patient mentioned that because they stayed out of school for almost 6 months, they had issues with stress and stress management, and also they were really stressing out over exams. And then also connecting with friends again after a long period of time can be challenging, because some patients feel that they feel more mature after completion of therapy because they have gone through a very intense process during cancer treatment. And also sometimes patients have to skip a class or repeat a grade. So sometimes their classmates move up, and that can also be an issue. So this patient mentioned that it was making them really nervous connecting with friends. In terms of academic challenges, patients can have a hard time for going back full-time to school, and they can get really behind with the assignments. And then also they can have a hard time concentrating. So this patient mentioned that they were clueless sometimes because they didn't really get some of the work done. So this slide shows now the challenges from parents' perspective, and it's really important to understand this process from both patients and parents' perspective, because they have different outlook of this particular topic. So parents shared challenges from communication and knowledge standpoint. So I'm sharing you here the communication challenges that could emerge after at the time of returning to school. So this parent mentioned that it was so frustrating because none of the teachers communicated among themselves. Like, they didn't know if this patient had leukemia before, and they were just surprised that there was no communication within the school about this particular topic. And also they felt lack of communication from the hospital standpoint, that the hospital did not really divulge the challenges that could emerge at the time of returning to school, because they felt that medical team did not want to tell them that you have to go through all this awful stuff during the therapy, and now it's going to get worse when the patients return to school. And lack of knowledge can also be a challenge. When parents are also taking one role of caregiving, being full-time caregiver of the patients, and now they have to also take the role of learning this new language of education and making sure that the patients are getting all the resources. That can be sometimes really intimidating. So this parent mentioned that they did not understand any of the word that was being said at the school, and they felt really completely out of their element. And also, at the same time, lack of knowledge could be an issue for teachers, because if they are not familiar with taking care of cancer survivors, they could be really intimidated when taking care of patients returning to school. So here, the parent mentioned that the teachers were so scared that they might be doing something wrong while taking care of the patient, and they were wondering if they should be sanitizing the school completely or what else should be done, and they had no idea because there was no communication about this. But at the same time, I just don't want to share everything negative about this process, because there could be some positive that could come out of returning to school, and actually some of the things that could help I'm sharing in this slide. And you will see a theme that the support from all the involved stakeholders is really helpful. So the first quote is about support that patient received from teachers. So here they say the teachers were really supportive, and the patient couldn't write because of their arm, but they let them bring their computer, and teachers were happy to go out of their way to help them. In terms of the hospital team's help, here the quote says that the hospital team was communicating by email, sending all the medication lists to the school nurse, and helping with putting the emergency plan. Also, classmates' help can be really helpful for patients when they're transitioning back to school. So in this patient's case, they had a hard time with starting the high school, but once they started returning to school and making friends, it was really easy for them, and it was really an enjoyable experience. And then parents themselves can also be helpful for patients when they are returning to school. So sometimes parents came up with their own strategies to help them, whether it is helping with their academics, helping with their preparing their backpack before going to school, or reading some self-help or devotional books, doing some meditation, exercise, and things like that. So as you see this, it's really important to have support from all these involved team members in this process. So next I want to talk about how can we ensure that this support is available to all the patients when they're returning to school or are in the school, and that could prevent or mitigate the school and educational challenges. So I know not everybody is in the process of returning to school, but I want to show this slide so that you guys can tell other parents who might be going through this process in future how to make sure that they don't have the similar experience you might have. So it's really important to plan early before returning to school. So we recommend that parents should talk to the healthcare team about the timing of returning to school after diagnosis, like when would they feel comfortable sending patients back to school. For example, in transplant recipients, we don't recommend they go back to daycare or school for a year, but that is not going to be same for other diagnoses, so it's really important to know this information. Also, it's important to understand what resources are available while patients are admitted in the hospital for continuing education, we do have some we have a good education program at Seattle Children's where we can make sure that the patients get education at bedside by teachers. And also it's important to have some homebound education or tutoring after patients are out of hospital. And also what resources are available for school reintegration? Are there any navigators or any other information that can be useful while returning to school? Also, in terms of actual return to school, it's important to assess patients' medical and emotional readiness for returning. It involves a thorough assessment by various subspecialists to make sure that yes, it is the time to return to school, including addressing their cognitive challenges that might be cause problems after returning to school, or if they have any challenges with fatigue or pain, those should also be addressed. And then also it's really important to reach out to school in advance and arrange meetings, preferably along with the healthcare team and school team with the patient and parent, so that everybody can have a communication together. But at least it should be discussed with the school in terms of what the patient's needs are and what should be focused on. And here I'm sharing you some more specifics about the information that can be shared with the school. So it includes details of all the medications that the patient is on, any specific medical conditions that the school should know about, or any specific limitations, and what are some of the criteria for notifying you if a patient gets sick at the school. Also, if there are any special precautions the school should follow when patients are at school. For example, some patients are still not fully recovered from in terms of their immunity, so if there is any particular outbreak at school like chickenpox, it would be important for us to know, parents to know, so that they can take appropriate next steps for the patient to prevent them from catching that. And then also, school should have the emergency contact information and the guidance from hospital about management of certain symptoms. And then also there should be some discussion about having individualized education plan or 504 plan, and need for any additional accommodations. Along with the school teachers, nurses, and counselors, it's also important for the patient's classmates to know about the patient's diagnosis. It can sometimes be challenging depending on the age of the patient and their classmates. So they may have some questions related to how the patient's diagnosis in terms of, like, is the cancer contagious? How did the classmate get cancer? Will that cancer go away or will it come back? Do they still need to do homework? And how can they be of help to the patient when they're returning to school? So this type of information can be shared by the teacher with your permission, and it can be helpful to discuss this detail with patient and also with the school before the patients return to school, so that this can be very appropriate, there is appropriate communication and less chance of teasing or bullying or other challenges after returning to school. I do want to share that Dr. Skylar Leonard is going to talk about more specific school support resources this afternoon in his breakout session. So please make sure to attend that, and there will be more discussion about the school resources. It's also important to make sure that there is ongoing assessment even after returning to school. So the challenge is not just at the time of return, but even on ongoing basis, there should be screening to make sure the process is going smoothly. So there should be a regular assessment of educational progress, and that can be done by the healthcare team, and not only what grade they are in, but also how many days of school they are missing. Did they have to repeat, or did they fail any grade? Do they have any individualized education plan or 504 plan? And how can they make sure to update it as needed? Also, and timely referrals to psychiatry or psychology should be considered in terms of any, if there are any emotional challenges. Physical therapy, occupational therapy follow-ups, and also neurocognitive testing should be done as necessary to make sure that we have a better idea about the accommodations that a patient should receive in the school. There should be an individualized health plan that can be developed in collaboration with the healthcare team, and it should be developed and revised at time to time depending on the changes in the needs. And then there should be open communication between school and healthcare team and the family in terms of any concerns, so that that can be relayed in a timely manner before the major challenges emerge regarding education. And then lastly, as Dr. Chow mentioned, it's really important to have at least one survivorship clinic visit once a year, so that this issues can be tracked longitudinally and can be addressed in a timely manner. And lastly, there are just few other recommendations in general from the previous patients who have gone through this experience, is that there might be some changes in the educational needs based on the treatment patients have received and the side effects they may have. So it's always important to learn, to embrace and adapt to this changes in the educational needs. Also, it's really important to try to keep social interactions going with classmates whenever possible, whether it's attending any events virtually or as much as possible from the from the health perspective. And then lastly, always it's okay to ask for help, whether it's to the school or healthcare teams, if there is any challenge while navigating this process and it becomes too burdensome. We're just here to help you guys, if any questions come up or challenges come up. And just lastly, again, I'm going to say that if the challenges happen, it's not because they are unique to the patient, it's because it can happen to anybody and you're not alone. There are a lot of resources available online regarding return to school, including one from Leukemia Lymphoma Society. There are a lot of slideshows, also some handouts that you can print out and share it with the school, including the healthcare plan and the other needs the patients may have at the time of returning to school. There is also a resource from American Cancer Society, Livestrong Foundation, and also from National Childhood Cancer Society. So definitely I would recommend you to check those out as necessary, and also share it with your other parents who might be going through the same experience. So with that, I'll stop here, and I thank you all for your attention, and happy to take any questions. Yes, I definitely agree, and we are actually doing a study here at our hospital to understand this return to school process in our survivors' families, what was challenging and what helped. So some of the quotes were actually from the study, and the hope is to improve this process at our hospital, and that starts at diagnosis and early on, so that it doesn't become too late and burdensome for the families. So we are definitely working on improving this process for our patients here. Yes, one of the recommendations from the patients and families who we interviewed was the need for a navigator, return to school navigator. So we are definitely looking into that and how to make sure that there is a liaison that can take that workload from you, because as I said, like it's hard to be a full-time caregiver and also wear like multiple hats and do the school navigation as well. So we are trying to make sure that we provide enough information directly to the school as possible. In fact, we also did focus group interviews with local school district nurses and counselors and teachers. So they are sharing the same concerns that they don't have always the information that's needed before patients return to school. So they would also appreciate some communication that could happen from us. So just repeating a question, just in case people couldn't hear. So the question was that is there going to be any board or any a group of people that would be working on this topic at Seattle Children's Hospital in future who could make sure that this return to school process goes smoothly and successfully for our future patients and survivors? So the answer, that would be ideal to have something like that, that type of resource. Right now, we are trying to like understand this a little bit more in the understanding phase, the challenges that are happening, and then the next step is to intervene. So once we have all the information available, I hope in the ideal world we would have a school liaison team that could help our future navigate this for our future patients and caregivers. But we do have obviously our school educators that are currently a resource for our patients, and they do actually help with the bedside education and at the same time help with homebound education as much as possible. And our social work, psychology, and neuropsychology team, they do work together closely as well. So we're hoping to, use this infrastructure we have to also make sure that we have improved return to school support for our future patients.
Such a deal. We went to the mic. I had a comment about the returning to school and having, like, the students know what's happening or having some sort of a meeting or something. I have a nephew who a couple years ago went through sarcoma treatment, had a partial amputation, quite a bit of surgery, way cool. They took his his ankle and turned it into his knee, so which made it so that he had better use of his prosthesis. And he was about 14, 15 when he returned to school, and he didn't want the kids at school to learn about it without him, so he used social media and did some little YouTube things about their last name is Janky, and he called it his Janky knee. And so he did like a little series of videos, and then when he came to school, he had kind of almost like a show and tell time where he showed everybody about his prosthesis and how it worked and everything. And it was pretty brilliant the way that he took control of that instead of feeling like people were talking about him behind his back, which was really important that they didn't do, especially as an early teen.
Yeah, thank you for this comment. Yes, I definitely agree. I think if it can happen with the patients, how patient wishes to share this information, that's the ideal way to do it. And I think it's always individualized based on how the patient wants to share this information or does not want to share the information. It can be either way. So thank you for sharing. Yeah, that's great.